Hey guys, it's Dee, and I am here just to talk a little bit to you about my OB clinical experience. So, basically, in a nutshell, I felt like it was my favorite clinical experience that I've had, like overall. Med-surg clinicals were not very fun for me, being that I felt like some of the nurses were not really willing to help you or make, be there when you have questions, and they kind of just brush you off to the side. So I wasn't really feeling that. I'm like, I understand that you have a lot of patients, of course, you have a lot of things to do, and you definitely don't need an you know, extra thing on your list. You don't need an extra person following you around that doesn't really know what they're doing, but that's kind of the whole point of the experience, is to have someone help. I know I have one nurse in med-surg. Ooh, that's for another video. But about OB, like just going to the L&D floor, they were so nice, so welcoming. It was just a different vibe, very friendly. You could feel the teamwork. So that was just really nice to like it's not like med-surg. It's very refreshing to have nurses that are very nice. So yeah, the nurses were nice. My experience, I forgot how many weeks it was, but definitely I got paired with one nurse, and just the way that she made me feel included, like she made me feel included. Like, she's like, oh, this is the student nurse. She introduced me. I followed her around. Oh my gosh, she was so nice. I can't even remember her name, but wow, I think she was a travel nurse, which is actually something that I'd be interested in doing, is travel nursing. So it was just great to get a perspective of someone who was just so sweet and so welcoming and didn't make you feel like you were a burden by being there. So I will say, one of my patients, it was amazing. I got to experience the entire thing, as far as admitting the patient all the way to sending her to the mother and baby unit, which is of course after you have the baby. Oh my gosh. So I'll just tell you a little bit about it. So basically we went in and we got our patient, and got her banded and whatever. Well, I think she already had her band, but we took her to the room. So got her out the waiting room. We took her to her room, and basically the first part was really just the patient assessment. So we asked, well, my nurse, she asked a lot of questions. I mean, I was sitting in that room, not sitting, standing, but watching her chart and stuff and ask questions. It felt like an hour. I really felt like it was an hour. So we got a lot of patient history, very thorough with questions. So it was very interesting to see the type of questions that you would be asking your patient. Yeah, so what else? Oh, okay, so then after we got done getting the history and asking the questions and doing the assessment, then we put on the fetal heart monitor, which is the thing that goes around the stomach. The little straps, there's a blue one and a pink one, and I think it's called the tachometer or the tocometer. I really don't remember. I need to kind of refresh myself on mother and baby stuff, actually. But basically we were able to assess the baby and the heart and all that stuff. So when you actually get to the portion of your program where you learn labor and delivery in nursing school, you will learn how to read a fetal heart monitor. So the A cells and the D cells, late D cells, what all of that means, what's a normal heart rate for the fetus. So that was just really cool to actually not just read about it in school and be quizzed on it and stuff, but to actually see the stuff that we were learning be put into action. So that was really great. And then after that, I believe her progress was a little bit slow, as far as how far she was. It was a slow process. So she didn't really I'm trying to think of the words and the terms. She wasn't progressing the cervix. So basically the 10 is 10 dilation of 10 means, okay, baby's here, time to get pushing. There's a different stages of labor. So I believe there is the active phase, the latent, I don't really remember, and I don't know why I'm making an LND video and not very well refreshed on LND stuff, which of course I need to do like ASAP because I have an exit HESI coming up and I need to know this stuff for NCLEX. But there are stages of labor. She wasn't making much progress, so I believe you're put on Pitocin to help with the contractions. So we had her on that. Oh, also I got to see, she wanted to do a natural birth. I believe some patients do want to do natural births. That means you don't get the epidural. And then, man, the contractions started coming. She was like, I changed my mind. So it was great. I saw an epidural be placed on another patient. Yeah, that was really cool. I think there's a specialized nurse who actually does that part of the procedure. So it's very sterile. They had us like against the wall. They said, nursing students, back, like y'all gotta So definitely need to give them their space. One thing you'll learn if you do any clinical experience is when it's your time to go. My hands are ashy, don't look at them. You're gonna know when it's your time to kind of back away, give the nurses their space and whatever. But yeah, that was definitely something I did for the epidural, was gave them their space. It was just really great to talk to the patient and just ask about her history and like, has she been pregnant before? I like to see how the patient and family interact because it's very different than med-surg when you have patient family in there and they're just probably just chilling or maybe ask questions or concerned. It's a very different energy and vibe because you're bringing, the patient is bringing a whole new life into the world. So it's definitely stressful depending on the different family dynamic. I can say, and it just varies. Every patient in L&D varies depending on their family dynamics. Some patients don't have a husband, some may have a husband, some may have their mom and their dad in the room with them, some may not. So some moms are, not, they're very moody, of course, it's a process. And then some are very nice. So I know the patient that I had, she was super sweet, super just ready to have this baby. So that was great. I really hope that I am not breaking any HIPAA violation at all by making this video. So if I am, let me know and I'll take it down immediately, expeditiously. I'll take this video down. But yeah, she was nice. So I basically got her to, making sure that she's comfortable was really the thing that I was focusing on. So are you comfortable? Do you have everything that you need? Is there anything we can do? Do you have any questions? Do you need me to get your nurse? Is there, whatever. So it was really great trying to build that relationship with the patient as well as her family as well. So from what my experience, all the fathers I encountered were some of them, they were very active, they were very involved. So that was amazing to see because sometimes that doesn't happen with everyone. So then with this patient the next day, it was time to push, which was amazing to see a live birth. I think my patient was the second one I saw, but it was just phenomenal to suit up, whatever, put on your PPE and whatnot, and just maybe, I don't even know how long the delivery was, but it just was so cool. I never thought that I would like it that much. It is literally like unexplainable. Once you do it, you'll like totally understand what I'm talking about. But wow, it was really, really cool. So I was really glad I was able to experience that. The first birth that I saw, I cried. I was like, oh my gosh, I didn't think it would be, it was great. I cried, I got emotional. Some people didn't cry, but man, funny story, I know I had some classmates, I heard, not saying it's true, I heard someone passed out after seeing a circumcision. Not laughing at them, but man, I wanted to see one and I didn't get the opportunity to see one. But make sure before you go to L&D clinicals that you eat something, snack up, bring snacks. I brought hella snacks, okay? I like to eat regardless, so I'm gonna always have food on me, period. But yeah, make sure you eat some side to you all, because it's ooh. Okay, so after the patient had the baby, it was cool. She was breastfeeding, so it was cool to see them initiate that. Sometimes if the mom has issues breastfeeding, then we bring a lactate consultant, I think, or lactation consultant. I don't know the name of it, but you're gonna get the gist of what I'm saying. That's somebody that helps with the breastfeeding. So that was cool to see breastfeeding for the first time and helping and holding the baby. I know with one of the babies I got to be with, I did vital signs. So, oh my gosh, I took the little baby's temperature. I just did a little stick up under her arm or his arm. I don't really remember, but I'm gonna say its arm, not to violate HIPAA. The baby's arm, and I actually, one of the interventions, so in nursing school you will learn the interventions of the baby. That's hypothermic. So her temperature was below, I think it is 97.5 for the babies. I'm gonna hope that's, I will put a correction right here if that's not the like minimum temperature, but it was definitely, the baby was hypothermic. So we did different things. He did put her under the warmer. When you put the baby under the warmer, you don't put the blankets on them. We put on a little head cap, warm her up. We did skin to skin, and eventually we did get that baby warmed up. And then also, I believe you want to feed them as well, just to get, you know, everything going. So it was just really great to like constantly I was a part of monitoring the baby's temperature, you know, very frequently, to make sure that we were making progress. I got to see a heel stick. I got to see I think the epidural taken out. Yes, I believe. One of the moms, I got to help her afterwards, like get her first time getting up, which is a lot. You definitely want to have support, because after having a baby and being in that bed and you losing all that blood and stuff, like the fall risk, alert, fall risk. So I was like, please don't fall on me. Yeah, all that good stuff. And I remember, I keep going off track, but one dad, it was his first time as a dad, and it was just so funny seeing him interact with the baby. He looked so scared to touch it, and I was like, you can touch her, you know, like that's your baby. He just seemed so in shock, like his whole world just completely changed, and it did. So that was cool. I'm trying to list some more things that I did. Oh, I got to see a C-section. It was great. I scrubbed in for a C-section, and the nurses were so nice. They were actually showing me everything they were doing. So the doctor was actually, it's so funny. I saw, I don't know if it was a meme or something, of a doctor, and it was like they play music before surgery, and let me tell you, he had his whole little setup, had his music playing. It wasn't like rap music or nothing, but it was just like, it was a vibe. Like he's like got his music ready, set, let's go. Like I was like, wow, I've never been a part of a surgery before, so that was cool to see, you know. And he showed me the placenta and the uterus, and like why he stitches it up that way. It was, wow, it was amazing to experience that. So overall, I'm trying to think if there's anything else that I can tell y'all about my OB experience that I did, and I believe that was just it. But overall, my opinion, I got to do a Foley for the first time. It was my second semester out of 4. Right now I'm in my 4th, about to start. But yeah, my second semester, this is when I did L&D, and I got to put in a Foley for the first time on a pregnant lady. And she had like, I don't remember if it's, well, I don't know, but it was bloody down there a little bit, and I was like kind of nervous. But here's the thing, if you've never done a skill before, do not let your patient pretend like I got this, I'm a pro, I do this all the time. Like I have done so many Foleys, like, because if you are shaky, sometimes I have shaky hands, or if your face doesn't look confident and you seem kind of like looking at your instructor like, oh, like don't do that. You're gonna scare your patient, and they might be like, I don't want you to do it anymore, and then you just lost your opportunity to do your skill. So I just told her, I was like, I've done this before, not on a real person, but I've done it before. So I was like, feel completely calm. And she was kind of nervous that really she was going to feel it, because she had got her epidural. But when after I did it, look, I don't even know how I got it on the first try, because everything was all down there, and I was just like, like, I don't know, I just slid that thing up in there. I don't know how I found the hole, but look, we just guessed, and we found it, and there was urine return, and wow, I did a Foley. It was actually pretty easy. So I don't know about you, but I like doing Foleys. Yeah, and I'm trying to think anything else that I did. No, can't think of anything. So overall, my opinion on L&D, or labor and delivery, OB, maternity, all that stuff, is that I don't think that's something I'm interested in doing, because what I like about it is it's not a lot of patient overload. It's probably 1 to 2 patient ratio, which is very nice, because I feel like I want to have that ratio where I can divert all of my attention on this patient, and I don't have to hop room to room to room. Because me, as you can probably tell, I'm a little bit scatterbrained. So just being able to have that focus, okay, I have this patient and this patient, instead of having like 10 freaking people, not really 10, but like 5 to 6 to 7 patients, I'm gonna forget something, and I'm probably gonna fuck up, and like, I don't need that. I need my license, okay? But I just like, being able to just focus simply on your patient, and monitoring them, and focusing on their needs specifically. So that was great. The nurses were nice. That might not be the case for all L&D specialties wherever you go, but I liked the nurses. I liked just the experience of bringing new life into the world. I feel like that just, you're not going to get that in any other specialty. So that was really cool to see. And it's a lot. I thought maybe L&D will be a little bit more chill, but it can get very fast paced really quick. Like, your patient or your baby can deteriorate very, very quickly. Like, things will go down south real fast. So a lot of times it felt like the nurses were chill at the nurse station talking. 10 seconds later, boom, everyone's up and running, going to the patient. You do this task, you do this task. And it's just like, it's like crazy town. I mean, it's literally like chickens running with the head cut off sometimes. So I'm pretty sure L&D nurses burn a lot of calories, and they just really have that passion to put in that work to really take care of their patients. So I do admire and have a newfound admiration for L&D nurses, but I feel like that's not really for me. I'm kind of leaning more, well, definitely, of course, I've always been leaning towards pediatrics, or even PICU. So hopefully one day I will be able to get in that field and like really decide if that's what I want to do. But other than that, you should comment below if you have your L&D experience, or was there something that I said that you could relate to, or if there's something I said that like that was not your experience at all. I kind of like, what are your experiences working L&D, or doing your clinical rotation in the maternity section specialty? Like, what was that like for y'all? But yeah, so that was it on my experience, and I've been talking like for 20 minutes now. Crazy. But I'm going to go now. I actually have some things to get to. So I hope y'all have a great day, and thanks for watching.